Ms. Sandalo.
Good morning, Chairman Catania. My name is Judith Sandalo. I'm the Executive Director of the Children's Law Center here in Washington, D.C. I join with the other witnesses in sharing my enthusiasm for the progress that the Department has made, and in particular the number of staff positions that have been filled and filled well. I wouldn't be doing my job, however, on behalf of the children if I didn't also spend a little bit of time talking about the urgency of the problems and raising some concerns. Before addressing those concerns, however, I want to applaud the Department in particular for recognizing the importance of providing consumers a mechanism to resolve complaints and for gathering information from consumers and advocates that will allow the Department to identify and address system-wide problems. We look forward to working with the newly formed Office of the Ombudsman to make sure that it successfully fulfills that mandate. My written testimony details why a well-functioning Medicaid system is necessary for D.C. and for its most vulnerable residents, particularly its children. I just want to jump into two problems and two solutions very quickly. The first is, of course, that the most important problem we have is that our system is just way too complicated. Numerous government agencies, an alphabet soup of DCPS, CFSA, DMH, and DYRS, each have their own systems and processes, as you know, for claim submissions, provider enrollment, and quality assurance. It's our understanding that the Department intends to adopt the recommendations of consultants from GW to procure a single administrative service organization. We think that's a critical issue, and we urge the Department to make successful completion of this timely its very highest priority. Every day that the ASO is not in place, the district loses revenue, and we are one step further from providing necessary health care treatment to low-income children. The problems caused by separate billing systems at each of the government agencies is compounded by the fact that children who are not in the custody of DYRS or CFSA are insured by several different managed care organizations. Each of these MCOs has different contracting and credentializing requirements as well as separate billing processes and rates. This has a particularly devastating effect on children's mental health services. The result is that DC's children simply do not have access to many of the specialty mental health services they require. I think you know quite a bit about this, so I won't elaborate. We're pleased that the Department of Healthcare Finance is going to investigate the possibility of pulling mental health services out of the MCO contracts in order to create a more tenable business climate for private providers and to allow for continued continuity of services for children. We strongly applaud this investigation. Children on Medicaid have a legal entitlement to a wide array of medically necessary services which they are currently being denied each day that the district's Medicaid system continues to be fragmented and disorganized. Because Medicaid is too difficult to navigate, as you know, providers refuse to accept Medicaid, and families cannot find doctors or they face impossibly long delays. This means that children go without services until a crisis arises. Crisis care is not only extremely disruptive to children and their families, it also costs the systems much more than routine preventive care would. We look forward to working with the Department and the Council to ensure new procedures and policies. Thank you.
Thank you, Ms. Sandalo.